You do a pregnancy test and the result shows positive. You are excited. Like everyone, especially those that are trying to conceive, they are excited. And those that don't really want a baby, they are sad and they are thinking of what next to do. But as a woman trying to conceive, as a woman that is already pregnant, or as a lady who doesn't want to conceive, do you know that there are different types of pregnancy that you should take note of? I'm going to be sharing with you 9 different types of pregnancy. Yes, so that you have an idea of what it is, so that you don't get surprised. Or especially for those that have gone to the hospital, they did a pregnancy test and the doctor is telling them there is no baby. So on this particular video, I'm going to be explaining everything to you so you know the different types and also have an idea of what is taking place in your body. So the first type of pregnancy I would like to share with you is the intrauterine pregnancy. The intrauterine pregnancy is a normal type of pregnancy. It's the one that is viable. Yes, this baby, there's an increased chance that this baby is going to stay till 9 months. For an intrauterine pregnancy, the fertilized egg, the embryo, they implant in the uterus and this baby develop properly and the placenta is formed properly and everything goes on well properly like usual. It's in the uterus, it's in the womb. So the baby is not far away from the womb. Nothing is wrong with the placenta and also nothing is wrong with the embryo. So everything is intact. That is the intrauterine pregnancy. Then the second type of pregnancy I would like to share with you is known as the ectopic pregnancy. For ectopic pregnancy, the baby is not going to stay. Yes, for ectopic, you've done a pregnancy test. The pregnancy test shows positive, but the baby has to go. But the baby cannot stay. Let me explain why. What is happening in ectopic pregnancy? Normally, when the egg is fertilized and embryo is formed, it tends to implant in the womb. But for an ectopic pregnancy, this thing that's supposed to be implanted in the womb, the fetus that's supposed to be in the womb, is not developing somewhere else. It can even develop in the abdomen. It can develop somewhere strange. And the most common one is the tubal pregnancy, the one that develops in the fallopian tube instead of inside the womb. So when you're having a tubal ectopic pregnancy or the one that's developing somewhere else, this baby can't stay. It's either the doctor tells you, oh, you have to do a surgery to remove it, depending on how severe it is. So it is better for it to be tackled on time to avoid the fallopian tube being ruptured. So that is the second type of pregnancy that you should take note of. Then the third type of pregnancy I would like to share with you is known as the chemical pregnancy. Over time, I've heard women say that, oh, I did a pregnancy test, but when it was time for ultrasound, the baby is not there. What could be the cause? I just want to let you know that that is called a chemical pregnancy. For a chemical pregnancy, you have had a miscarriage before the baby was detected in the ultrasound. There was a miscarriage before the baby was detected in an ultrasound. So that doesn't mean you're not going to get pregnant again. It's just a chemical pregnancy. Definitely you are going to ovulate and you are going to get pregnant again. The fourth type of pregnancy I would like to share with you is known as the multiple pregnancy. As the name implies, multiple pregnancy. For those that are trying to conceive, the multiple pregnancy is a thing of joy. This is when this woman gives birth to more than one baby. Yet it could be twins, it could be triplets, it could be quadruplets. It's multiple pregnancy. For the twins, it could be identical or fraternal twins. Identical twins, you know what I mean? They're identical. You can't even differentiate them. If it's a male, you get two male. They are similar. They have similar characteristics. Well, in terms of fraternal twins, it could be male and female. It could be female and female, but they have different characteristics entirely. So that is also another type of pregnancy you should take note of. Then the fifth type of pregnancy I would like to share with you is the high risk pregnancy. As the name implies, high risk pregnancy. It simply means that everything needs to be taken into consideration when taking care of this woman, not to put the mother or the baby at risk. For those that are at risk of high risk pregnancy, it's actually women that are above the age of 35 years of age, that are above 35 years of age, and also people that have diabetes, We have those that are, during the course of their pregnancy, they develop hypertension, which is a pregnancy-induced hypertension. We have those that develop gestational diabetes. We also have those with previous medical history or surgical history that puts the baby they are going to be giving birth to at risk. So if you're having a high risk pregnancy, it is very, very important for you to take the advice of your doctor to ensure that you and the baby is fine at the end of the 9 months period. Then that takes me to the sixth type of pregnancy, which is the breech pregnancy. Unlike the normal pregnancy, like the cephalic, in which the head is down, for the breech pregnancy, the buttocks of the baby is down rather than the head. Okay, so depending on how it is at that particular moment, the doctors might advise you go for a cesarean section. Then that takes me to the seventh type of pregnancy. That is the false pregnancy. I've made a full video explaining what false pregnancy is. False pregnancy is a type of pregnancy where a woman feels she's pregnant, she's having all the signs of pregnancy, but the ultrasound and also the blood and urine test shows negative. Then the last type of pregnancy I would like to share with you is the molar pregnancy. I know you may want to ask, what is the molar pregnancy? In simple terms, molar pregnancy is where abnormal cells grows in the womb after conception. There are two types of molar pregnancy. We have the complete molar pregnancy and the partial molar pregnancy. For the complete molar pregnancy, what is happening is that you have abnormal cells growing in the womb, but there is no sign of a baby. There's no sign of a fetus growing. But for a partial, you have abnormal cells growing in the womb and there is a sign of a baby. There are some, there's something that shows that there's a baby. But in all, be it partial or complete molar pregnancy, the baby is not going to survive. Be it partial or molar pregnancy, the baby is not going to get to term. Like I earlier said, for complete, there is no sign of a baby at all. It's just abnormal cells that are there. But for partial, there is both sign of a baby and also abnormal cells. But in general, they won't survive. So for those women that are saying that, oh, I did a pregnancy test, it was positive, I went to the hospital, but the baby is not there, it could be chemical pregnancy. And for those that says, oh, my baby was growing perfectly well, but the doctor started suspecting one or two things and they said, oh, it has to go away, it could be molar pregnancy. But in all, whatsoever you are facing, it's advisable for you to get a better understanding from your healthcare provider. Let them tell you what is actually wrong. Let them tell you what they saw on the scan. Let them try as much as possible to explain to you so you have a better understanding. And also, don't forget to ask them questions. Don't forget to ask them questions about what is going on, because they are your doctors and you're paying for their services. That is what I feel. So if I'm paying for your services, ask them questions. They might not have the time because of the large large attendance, the large patients that they have to deal with. But try as much as possible to get some more information for them if you need further clarification. Okay, thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.